Well, one thing we can talk about is your patients, because they come to us all the time. They've been coming to us all weekend. They've been coming to us with the coronary artery disease. They're in line for a stent. With the pain of angina pectoris. They come to us with their type 2 diabetes. They come to us with their Crohn's disease. They come to us with colon cancer and prostate cancer, and they come to us, and they come to us, and they come to us. So we have a little bit of experience in interacting with your patients because they're coming to us. And one of the reasons we're doing this campaign is, of course, we're not doctors. We would like to send them to you and that you supervise their care. And we're very careful that way. You can rely upon us that way for sure. However, we've learned something about people and changing their diet in a medical context that we think that we can share that will be of value. One thing that concerns us greatly, and this should be of concern to every healthcare provider, is your patients are turning to the internet, Dr. Google. And they will keep on searching through Dr. Google until some website tells them what they want to hear. And I know that many times from the reaction in the audience, I could tell that many of you are worried about this. We're worried about it too. This makes it even more important that they get information on how a plant-based diet can be used to prevent and treat disease appropriately from their physicians. We need you to know this because without you, that's what they're doing. And we hear about them all the time. You know, I Googled this and I Googled that, and there's all kinds of websites out there, but it often is not authoritative medical information. And so that's one reason alone that we need all the doctors to know this. Your patients want to hear it from you. They want you to know about this. They're relying upon you. Now, the comment I get from many docs is that this is all very well and good and the science is really strong, but my patients will never go for it. You must be kidding. We beg to differ. We think your patients will go for it if you handle it in a certain way. Evidence shows, and you can see the documentation, and by the way, we're documentation fanatics. We know that our science has to be strong and our documentation careful. Evidence shows that patients will switch to a vegetarian diet once their doctor explains it and prescribes it. And one thing that is amazingly powerful that we've noticed, write it down on a prescription pad or on your stationery. That patient has your name next to your prescribed diet, and they take it home and they share it with family. And when they get comments that, hey, doctor's orders, my doctor told me to do this. And it makes a big difference. It makes them feel more secure. They're so used to getting a prescription for a beta blocker, an ACE inhibitor, or whatever you like, that they're used to receiving their treatment, their treatments in the form of a prescription. Write it on a prescription. Plant-based diet, fruits, vegetables, whole grains, legumes, TID, okay, with every meal. And so do that, write that down, and we are amazed that those patients seem to do much better. It helps them in a social context, it helps them with their friends at work, it helps them with families, and it helps because they actually look back at it. They even bring it and show it to us, okay? I'm here, my doctor told me that I have to follow a plant-based diet, that that's my best course of treatment. And they'll come and they'll even show it to us. And we're okay, great, wonderful. And so here we are. That will help you a lot. So there was concerns that some traditional diets are meat-centered diets. And we respect that. But still, we feel that it's the physician's position and duty to inform their patients of what the healthiest diet is for them. And this was tried. They went to Appalachia, which had a very strong meat-eating tradition, and they explained it to their patients. They wrote it down on a prescription pad, and they went for it. They went for it. The thinking is that the patients won't go for it. Will all your patients go for it? Of course not. What out there has 100% patient compliance? Not much. But enough will at least offer it to them. That is an option. And you can see here, this was a study in Appalachia. There you can see the fine people of that region of the country. On a 4-year study for cardiac patients who were prescribed a plant-based diet, 89% compliance. Maintained over 4 years. And so, again, and you know, once the patients see the benefit, they'll want to maintain it. That's the other part. When they went to Appalachia, they took the following approach. And they said, here is the path ahead. If you continue eating the way you are, we're going to need to prescribe reductase inhibitors, you're in line for a stent, et cetera, et cetera, et cetera, et cetera, et cetera. You have essential hypertension, and we're going to need to prescribe something to get that down, even if it's just a diuretic. But if you go on a plant-based diet, here's what your likely treatment outcome is going to be, and here's what you'll need. Okay, you decide which would you like to do. And it was very good patient management doing that way. Again, not 100%. Explain the efficacy of dietary intervention. Emphasize its safety. Your patients, and this is something, if we've learned nothing else at Vegetarians of Washington, more than just prescribing it as a treatment, your patients want to hear you tell them that it is safe. They are worried that they will suffer some health consequence if they follow a plant-based diet. I say this with a great deal of confidence because we are doing this work for 17 years at Vegetarians of Washington and dealing with people. People are afraid. They're afraid something will happen to them. What changes that paradigm is when their doctor says, it's safe. This is a safe way to go. This is a safe diet, it has health advantages. They are worried about safety. This is particularly true for women and particularly true for pregnancy, but it's true overall. And it's especially important not only when working on prophylaxis to prevent many of these diseases, but it's especially important when treating a patient who already has some pathologic process going on, because they are so nervous at that point. They are so vigilant for some change in their condition. They are so worried. They feel vulnerable. They feel weak, often they tell us. And they need to hear that it's safe even more than the general patient that is, you're just prescribing it because you can see down the road, I've got a case of type 2 diabetes if we don't have an intervention now. So we talked about right in patient and involve the patient's partner, family members, you know, explain, hey, this is what dad needs, this is what mom needs, and it helps quite a bit. Again, as we said before, we think that the approach in Appalachia is very helpful. Give the patients a locus of control, prescribe it for them and say, here, you could take this prescription for a plant-based diet, or here's what you may be at risk for, and let them choose. And I think when you do that, they have buy-in. You tell them it's safe, you prescribe it for them, but you leave the ultimate decision. You're not going to withhold their medications. And by the way, this is really important. Medication, we know, and we know well that medication and surgery are lifesavers. We do not want to live in a world without it. This is an additional treatment, an additional prophylaxis that's available to you. We're not in any way advocating for the abolishment of medication or surgery, but what we are saying is they might be much less necessary, and you may even be able to reduce some dosages with a plant-based diet. Why hasn't this been proposed before? And this, I think, is a major factor as well. And we call it technological tunnel vision. And we think to some extent that medical practice in the United States has this to some extent. They're waiting for the latest advanced molecule that's come out of the pharmaceutical industry. They're waiting for the latest robotic surgical technique. And these are all very valuable things. But sometimes simple things are very powerful treatments. And so while, yes, pursue the technological advancements, we are 100% in favor of it, a plant-based diet, there's not much high technology required. a stove, a blender. It's not, doesn't get very advanced. But sometimes low-tech treatments can be very powerful indeed. And the patients need to understand that too, that say, hey, you know, this may be low-tech, but it's also very powerful. As we mentioned, in our view, this is an additional treatment modality to surgery and medications. And of course, you'll want to individualize the treatment of every patient. And even the time between different labs that you order may be different. Sometimes a plant-based diet takes a little bit longer to work, and you want to hold off on your labs. But what you also want to do is titrate your meds, okay? So if you have a patient on metformin and you see as the plant-based diet kicks in, you want to titrate the metformin down on your type 2 diabetic as the treatment effects of the plant-based diet become evident. And the same thing with hypercholesterolemia or hypertension and other things like that. So that's some pointers that we have, looking at it from very much from the grassroots level and speaking to your patients. And we thank you all very much. And we'd like to invite up our next speaker.